The United States is a very, very big country. And something like universal health care or free health care would be a very expensive proposal, considering that roughly 30 to roughly almost 50% of our income is taxed. Now you might be going, well, Casey, it's the income tax ain't 50%, and you're right. But including different sales taxes and property taxes and other things, I mean, you're looking at anywhere from 30 to 50%. And in some brackets, it's closer to 55 of your income in some way or form is taxed. So to have some kind of free or universal health care that the government's going to have to pay for, they're not going to eat that bottom line. What they're going to do is that they're going to raise taxes to pay for the universal health care that they are going to contribute to you. So you're still paying for it, just with a really big middleman. Another big reason why some of these other nations have free or universal health care is because of the fact that, especially like NATO nations, we essentially subsidize their military. Okay, so by being the biggest contributor to NATO, which we shouldn't be in to begin with, and by having these military bases in Germany and France and the UK and so on and so forth, and basically having all these alliances with these other countries, it basically allows them to not have a large standing army like the United States does, because they know they can always call on us for help, and therefore they don't need to have that big military, and therefore they can use that money they're not using for the military in order to have free healthcare. It's not a hard concept to understand. The third reason why a lot of these nations have universal or free healthcare is because, just as previously stated in the first reason, is that they are smaller nations that are largely pretty homogenous, and it's not a diverse nation with diverse ideals or cultures like the United States. You know, if you have a nation like, say, Venezuela, that is a very socialist country, well, let's ask the people down in Venezuela how that's going out for them. Let's ask the people in Canada how universal or free health care is going out for them, considering that just to get a primary care physician, you're looking at 6 months wait to see your PCP, and then it can be even longer to see a specialist, like an oncologist or something. It could be a year. And if you got cancer, a year is a long time to wait. A lot of Canadians are actually coming to the United States to seek healthcare because they can get it faster than they can in Canada. So that's just some things to consider. And if you really think that universal or free healthcare is something to really brag about, or just that sounds really awesome because you think you're not paying for it, like I said, it'll be paid for through taxes. There'll be increased to pay for it, because the United States government is not about to just say, yeah, it'll just be free. We're just going to earmark the taxes that we're already getting, and we're just going to do it for something else. It's not going to happen. The United States does not work that way as far as the government, and to believe that the government's going to do the right thing is complete naivete.
Hello everyone, this is Emmanuel Cook. We will be reacting to a new video today, so make sure you guys like, comment, and subscribe down below, and let's get into the video.
5.5 hours waiting in urgent care to find out that I have pneumonia. The nurses were great. I was about to leave at hour 3. They said, let me check where you are in the list. They looked at me, said, don't leave. We advise you not to leave. So I didn't. And in that moment, I knew I had pneumonia. As soon as I saw the doctor and he was, yep, you have pneumonia. Here's your prescription, all of this. I was so emotional because as women, I feel like I've been feeling like shit for the past week, specifically from like last Wednesday. So for 5 days. And I've been toughing it out. So I'm like, no, I'm fine. But I knew something was wrong. I'm already getting emotional. I knew something was wrong. And when someone says you are sick, and then I feel like I have permission to be sick, which is such a crazy thing. Like, I knew I was sick last Wednesday, and it's just an interesting thing. I think a lot of women do this. We like fight through it and think that we're fine, or just know that we can push through. But as soon as I was like, oh, I'm validated, you actually are quite sick. Pneumonia. I have pneumonia. Then I'm like, okay, I can actually take the day and not do anything, because I would be doing other stuff thinking I'm probably not that bad. It's just a wild thing in our brains. It's wild.
I just had a full health checkup in China and it was crazy. I had like 9 tests done. It only took about 2.5 hours. So it starts with you go to this special ward that's dedicated to the health checkup, and each exam room is dedicated to a different test. And it's like clockwork. They're extremely efficient. The first thing that you do is, because you can't eat for 10 hours before the blood test, they do that first. I went into a room and then this lady pulls out a needle. She draws my blood. It's in a file. 2 minutes from the point that I go into the exam room to where they're saying on to the next thing. 2 minutes. Then I go on to the next thing and they have me take a pill which tests for H. pylori. You have to breathe into a tube after 20 minutes. So I do that. I take the pill and they're like, you already did your blood test, so now you can eat. And then after eating food, I go and they do a CT scan of my chest where they're checking all my lungs and stuff. And then I go and they do a full physical exam where this guy like checks my thyroid and all my lymph nodes and everything. And then they take your weight and height. They check your nose, eyes, and ears. And then after that, you go in and get an EKG. So they put this thing that'll monitor your heart for the next 40 minutes. Then they do a ultrasound of your kidneys and your liver, and they just check for anything weird going on in there. At the end, you blow into the tube and they take the heart monitor thing off. The whole thing honestly took like 2.5 hours. It was crazy fast. And it's a really vulnerable thing to go to the doctor and not speak the language. They were professional about it and they did their best to be patient with me and translate. They made sure I knew what was going on before I actually got the tests. And then I'm actually gonna get all my results on WeChat on my phone. And if there's any concerns with my blood work or anything, they'll just message me and say, hey, you need to follow up. So yeah, that's a health checkup in China.
Welcome to Canada, where we have free healthcare. Now I'm going to tell you what comes along with that free healthcare, because friends, nothing in this life is for free. As a Canadian who's lived in Canada most of my life, wasn't born here, but I was raised here, I will tell you that free healthcare is not as great as you may think. In fact, I think it's actually named incorrectly, and it should be named free emergency care, where if you have a very serious emergency and you need surgery, yes, it is free. But my friends, that's also named incorrectly, because our taxes are so damn high in this country that you're already paying for it. Want to know what else you get with free healthcare in Canada? Long ass waiting times everywhere. Want to go see your doctor? Especially during cold and flu season? Prepare yourself to wait 2 to 3 hours, sometimes even more. Your kid has an emergency, so you decide to drive to a children's hospital? 6+ hour wait times. Just to be seen. That doesn't count the diagnostic and anything else that needs to be done if your child needs anything else. Want to see a specialist? You can't. Your doctor has to refer you to the specialist. And the government monitors how many times your doctor refers you to XYZ places, so your doctor is very cautious of where to send you. Sometimes, most times, not sending you at all. Children don't have pediatricians here unless they have a problem. And when you do finally get a referral for a specialist, your wait time is anywhere between 3 to 8 months to see the specialist. And then when you finally see the specialist, the wait time if you need some sort of surgery or procedure is another 3 to 8 months. I don't know about y'all, but for a citizen of this country that pays up in taxes, I find these wait times absolutely atrocious, unacceptable, and disgusting. Now, I'm not just telling you these things because I heard some people talk about it. I'm telling you these things because I have personally lived it. So I don't know about y'all, but I think this shit's criminal. Healthcare in Canada is not free. You're paying taxes, very high taxes, but you're not seeing the result of that. So the next time some Canadian tells you that they're so proud to have free healthcare system, ask them if they have a brain.
Healthcare around the world. We are starting in Canada today. And a lot of times, free healthcare, you are paying high taxes, first of all, and you're paying for your time. If everything is free, you're paying for it with your time. 8 months just to see a doctor. That is insane. If you have any issues, real life issues, life-threatening issues, how can you wait 6 months, 8 months just to see a physician? Those wait times are insane. And if your issues are chronic, you're cooked. You're literally cooked. We need both free healthcare and paid healthcare. If you need urgent care, use the private healthcare. If your care is not urgent, use the free one, the public one. That is a perfect balance between the two. One of them, you're paying for your time. And we all know in healthcare, you need time. You need urgent care. And if you have to wait 3 months, 6 months, 8 months, even up to a year, that is ridiculous. And you could actually die because of lack of care. So we need both of them, both private and public.
Guys, I got this 400 krona bill in the mail today, okay? And this is from the emergency that I visited, say about 3 weeks ago, where I did not really get any medical assistance. There was just words being told to me, and I was told to just take care at home, and I wasn't really given any clear answers of what has happened to me. And then I get this bill. So healthcare is clearly not free in Sweden, because they were the ones who actually insisted that I drive down to the emergency at 4 a.m. only to tell me that they can't do anything. So, you know how I spoke about how Sweden doesn't give you medication that you don't need? Turns out they don't give you anything even when you do need it. But also, like, they bill you for nothing. So what is happening? I know a lot of people are going to be like upset that, oh, you know, you've come from India and you're complaining about this and that. One thing that I don't like is deception. So yeah.
So I had my first experience with the French healthcare system this week, and I have to say I am pleasantly surprised. I'm not sure if every experience is going to go this way, but this one was super painless, super inexpensive, and made me feel so relieved that I have access to healthcare in a country that actually cares about its people and isn't just after the bottom line. So I woke up with a swollen eye. It's still a little crazy looking right now, but it's getting better. And I was freaking out because I live alone. I'm in a foreign country and I'm like, what the F? Never had this experience before. So go online and I am able to find a video call with a doctor within 15 minutes of my inquiry, which is amazing. The US could never. And so I do the call. He's like, okay, I'm going to prescribe you some medicine. Wonderful. So now I go over to the pharmacy thinking, you know, they're going to ask me for my health insurance. I have to have private health insurance as a foreign resident here, at least within the first year before I get my carte vitale. So I have healthcare. And when I got to the pharmacy, nobody's asking me for anything. No health insurance card. Everything's fine. Just sent her my prescription. And my medicine was €5. €5. Amazing. No healthcare? €5? Kidding me? US could never. So I really hope I never have to use my health insurance for anything beyond this little experience. I'm not sure if they're all going to go this way, but I am just so relieved after all of the PTSD from my doctor's visits in the United States. Vive la France. Love it here.
The American healthcare system is a joke. It's a joke. Let's talk about a thing that happened to me in Italy today. I live in Italy. I work in Italy. I've worked in Italy since I was 18, but I also used to live in the US. So I've been in the healthcare system in the US where I had insurance, and in Italy where we pay taxes to fund the healthcare system that benefits everybody, if you're rich, if you're poor. Now, the healthcare system in Italy does have some problems. It completely depends what area you live in. It could be fixed. It could be a bit better, but everyone does have access to care, whether you are rich or you are poor. I had to get an inhaler, okay? Because I have asthma, mine was expired, and I was feeling very like, I'm about to have an asthma attack. Something is happening. So I went to get my inhaler. I just walked into the pharmacy and I was like, hi, I need my inhaler. Showed her my, medical documents. She gave me this, an inhaler. Do you know how much this costs in the US? Almost $300. Do you know how much I spent for this inhaler? €4.50. €4.50, that's like $4.50. Now here's the thing that really grinds my gears, okay? AKA pisses me off. I am someone who has a job. I have a good job. I could afford insurance in the United States if I lived in the United States, and I am very fortunate to be able to hypothetically afford insurance in the United States. And in Italy, I have access to the healthcare system because I've lived, worked here, and paid taxes since I was 18. But if I didn't have the job that I had, if I was a student, if I had a different situation, if I couldn't afford health insurance, how are you supposed to pay for this? Can you pay $300 for an inhaler? Okay, can you? I don't know. Not everyone can afford all of this stuff. By the way, this inhaler, I have it because I have asthma. I haven't had a serious asthma attack, knock on wood, corna, in years. I buy it for prevention in case I need to use it. But if you can't afford it, maybe you won't buy it, okay, if you're in the US, because it's too expensive. I know that the Italian healthcare system still has issues. It needs to be, there needs to be more funding. It could be fixed. But I'm very fortunate to have bought this product today for so cheap. And I'm just grateful that I live here in a place where everyone gets access to care. That's it.
A quick reminder, please remember to like, comment, and subscribe down below. And let's continue the video.
So a lot of people have been asking me about the medical care or healthcare system in New Zealand and why I think the medical care in the Philippines is better. So when I say medical care, this is of course paying for private hospitals so you receive top service. In New Zealand kasi, you need to see a general practitioner or what we call a GP or your family doctor before you see a specialist. Your GP will then examine you and determine whether or not you get referred to a specialist. More often than not, you do get a referral, but I guess it depends on your health situation. Now, from my experience, I never really received the level of medical care that I received here in the Philippines. So for example, I've been undergoing a series of tests back in 2021 in New Zealand. I went to see my GP. I was referred to Auckland District Health Board, which is the local governing body of health care in New Zealand. They ordered a series of tests for me to undergo. One of those tests was not subsidized by the government, so I had to pay $800 only for my test results to get lost. So in December 2023, I visited the Philippines and I went to Makati Med to see my sister-in-law's OB. She ordered the same test for me to undergo. I received my results within that same week, and I've been under her care since. Easy. There was no waiting for me. Unlike in New Zealand, where I had to wait months even for someone to get back to me. Another experience of mine was when I got sick. I went to see my GP. I was prescribed this particular medicine that gave me severe stomach pain. After following her instructions on how to take the pill, only to find out that it has been made obsolete in other countries. The worst experience for me personally was when my Lola passed away in New Zealand in 2004. She was confined at the hospital. From what family members here in the Philippines have been explaining to us, they should have done a series of medical treatments on my Lola to save her, but they never did that in New Zealand and they only treated her too late. So obviously, I'm comparing public healthcare in New Zealand and private care here in the Philippines. So you'll have to pay double, if not more, to receive private care in New Zealand. I find that there's better and more advanced technology, private hospitals here in the Philippines than in New Zealand, and just overall easily accessible here in comparison to receiving the level of medical care that I would want in New Zealand. Look, I'm not generalizing that the healthcare system in New Zealand is crap, but based on my experience, I definitely received better medical care in the Philippines.
So today I went to the hospital here in Spain as an American, and I want to talk about my experience because I think it's so important to talk about. I obviously grew up in the US where you pay your health insurance, you go to the hospital, you get your treatment done, you leave, you might pay copay, and then you get the bill at the end. Here in Spain, now I am autonomo here, so I have a visa to live here, so I pay Social Security in Spain. I went to the hospital today, I fell down some stairs, I got stitches, I got an x-ray on my back and my arm to make sure nothing was broken because I had quite a hard fall. And the EMTs came to where I was at the gym where I fell, and then they took me in an ambulance to the hospital. I got my x-rays done, they gave me stitches, numbing, they gave me medication. They sent me on my way home, and all is fine. I'm now resting, obviously. That cost me $0, like out of pocket. Obviously, I do pay into Social Security, so that goes towards my healthcare, but it's so different in comparison to the US because in the US, when I lived there, I paid like $400 a month for insurance. And granted, this was 6 years ago now, but I paid $400 a month for my own insurance. And at one point I broke my foot and I went to urgent care and I worked in orthopedics at the time. So I knew exactly what I broke. And I was like, hi, I broke my fourth metatarsal. Can you please like x-ray, give me a cast and send me home? And they're like, yeah, of course, no problem. Did the x-ray, doctor came back. He was like, yep, you're right. Fourth metatarsal broken. Here's your cast, here's your crutches, sending you home. And it was 45 minutes in total. I got a bill like a couple weeks or whatever later, and my bill was like $16,000, and my insurance covered a good portion of it, but I was still out about $2,700. Mind you, I paid a copay to go to the urgent care. I think it was like $150 or something like that. And I paid $400 a month for my insurance, and then I was still out $2,700. I'm in Spain, and I did the whole 9 yards ambulance ride, EMTs coming to me, pay nothing. So I just don't think America actually cares about your healthcare. Like, I just don't think they care about the health of their people. Otherwise, they would make it so that way it doesn't put people in debt or cause people to go, oh, actually, I'm not sick enough, or don't worry about taking an x-ray because I don't want to pay for it. Like, that's insane. And I just think it needs to change in the US so badly. But I'm so grateful to be living in a country where my medical bill was actually just $0 and I got good care.
One of the reasons why I want to go to Europe is because of the healthcare. Overall, I think that the healthcare in Europe is a lot better than in the United States. At times, there is a long wait time and stuff like that. But overall, I think that it is a better system overall than in the United States. And she is a perfect example of it.
Okay, I'm going to quickly talk about how healthcare professionals are here in Egypt. When I tell you they are amazing, they're amazing. Alhamdulillah, alhamdulillah. So far, like, every healthcare professional I've encountered, they're super professional, super nice, super kind. So the experience has been excellent. And as you guys can tell, I literally got aligners like 2 days ago. And I just want to say, if I did this back home in the States, I would have probably gone bankrupt. Because we are in a student budget still. But here is so affordable, guys. Like, I'm literally so happy. Like, I only have like an overbite, or is it an underbite? I don't really know. But my teeth are not that messed up, but I know that this is going to work. So I will update you guys on how this turns out if you guys want that. And if you guys want to know who my dentist is, I will let you know because they're amazing.
I am Danish and I would always prefer to go to the emergency room in Brazil than here in Denmark. I have lived in Rio for several years and I never had any health insurance, and I went to the public health place and it was great. It was so good. Whereas here in Denmark, it's like you really have to talk your case, beg, exaggerate to get your point across. In Brazil, I really felt like there were resources to help me and a great interest in curing me. This could be because I'm a tourist and from Europe and white, but I made a video about this in Portuguese, and after that I have received so many comments and stories from people who have experienced the exact same. Brazilian people who now live here in Denmark and who do not know how to deal with the system here. There are various groups called Brazilians in Denmark, Brazilians in Sweden, where people literally ask each other, how do we talk to the doctors here? Please somebody give me an advice. And the advice is very often, you need to just exaggerate, you need to stand your case, bring someone else with you, or go to Brazil and get it done there. It's really crazy that it's like that, but it truly is. Thank you very much, SUS. I have really used SUS a lot. It's even free for foreigners. I'm very, very grateful, and I felt very good taken care of. And when I go back to Brazil, I will go to SUS. Thank you.
I just need to rant for a second because I'm so sick of the UK healthcare system and just being disregarded by doctors. Don't get me wrong, I work within the NHS and it's the best thing that Britain has going for it. But I think I spoke maybe about a year and a half ago about the chronic exhaustion that I experience, and I've experienced for years. And I went to the doctor about this multiple times over the years, and they just kind of put it down to glandular fever the first time when I was like maybe 18, 19 when I experienced it. And then obviously, bam, turned 19, got raped, and now I'm on psychiatric medication, and now they're blaming it on the psychiatric medication, and I'm like, no, that's not it. It happened before that, but they just have a new thing to blame, so of course they're going to blame that. They've done blood tests, they've done everything, and yeah, sometimes my bloods have come back that I'm anemic, so I've taken the iron tablets and then I'm not anemic, but then I still feel the same. Vitamin D, done the same, and I'm so sick of feeling chronically exhausted. So today I drove to work and I was literally falling asleep whilst driving to work. So I pulled over like a responsible person and I got a large iced latte from Starbucks, and I had, 5 shots of espresso. Because it's a large, it gets 3, and I asked for an additional 2. It's done nothing for me. So I got to work super early today because the traffic wasn't bad, and I've literally had a 20-minute nap in my car, and I really don't feel much better. And I'm so sick of doctors saying it's a trauma response. No, it's not. No, it is not. I've had this for years and I've just been palmed off and palmed off and palmed off. If it is chronic fatigue, then what is the treatment? If it is narcolepsy, what is the treatment? I am this close to going private and getting a private consultation, but A, I can't really afford it at the moment with buying a house. And 2, why should I have to when my national insurance tax should fund the NHS to give me sufficient care? I hear so many people in this country say, I don't know why people on the straight and narrow get pulled into drugs. This is why. Because if someone came up to me and offered me a methamphetamine right now, I would take it. Feeling tired is the worst thing in the world. And if you know me personally, if you ask how I am, I will just tell you I'm tired. Please tell me that I am not alone in this. Does anyone else experience this?
I wish Americans would experience healthcare in Russia. Everywhere, in every single city, even a small town, there are hospitals where you can walk in and it looks like a hotel. There are government hospitals that are free for all Russians, but also you can pay and go visit these privately owned hospitals. You're walking in, there is a receptionist, and you're like, okay, I want to do an x-ray, or I want to check my blood, and they will have a menu. Oh, you want to check your blood for what? Vitamin level, mineral level. Oh, you want to see your liver panel, or you want to see your thyroid condition. You may do that first. Or you can be like, okay, I don't understand anything. Can I talk to a doctor first and see what doctor says? You pay $10, you go see a doctor right away or next day. The wait is never more than 3 days. You talk to a doctor and they're like, okay, this is the test you might want to do. We can do an ultrasound right away. They take you to do your testings, and the same day or the next day you will have a result to your email. After 8 years living in America, I still don't understand how people live here. That's the one thing I suffer the most. I used to compete in bodybuilding, and me not being able to just walk in and be like, I need to check my vitamin D level, my zinc level, I want to see the protein in my blood, and I want to see my hormonal levels. And I want to do this every month. And I'm so pissed that this simple right for healthcare is taken away from me. Oh, and if I want it, it's $3,000 a month.
Is healthcare in Brazil better than healthcare in the United States? I was recently asked by one of my followers about the difference in healthcare in the United States versus Brazil and my overall thoughts, and I thought this would be a really good topic to really discuss further with you all. So let's just get this out there. Brazil has free healthcare and the United States obviously doesn't. So Brazilians can go to a public hospital for any medical problem that they have to seek care, and it will be free. But then they also have the option of going to a private hospital and either using their private insurance or paying out of pocket. I personally think that it's amazing that Brazilians have the option to either go to a public hospital and not have to pay out of pocket for their medical care, but they can also go to a private hospital that might be a little bit more on the higher end and also seek care and pay out of pocket or pay with a private insurance. And I think it's just a wonderful thing to have that choice that we don't have here in the United States. I just dropped my makeup brush. Versus in the United States, you need to have insurance if you want medical attention. Of course, now we have Medicare, Medicaid, which is government programs that assist with payment for healthcare, but it's not the same as like universal public healthcare. I'm from Massachusetts, where we have a lot of top hospitals and medical facilities that you can go to seek care, like the Boston Children's Hospital, Mass General. We just have a lot of great options. So that's one thing I will say, that in a lot of private hospitals within the United States, and specifically in the Boston area, you have a lot of options for really high quality care. But let's be honest, there are some real struggles and complications with seeking care in the United States or seeking care in Brazil. Example, one time my husband, he used to ride motorcycles when we lived in Brazil. He had an accident and he actually fell off the bike and his fingers like broke all the way back. Like they were popped out of the socket this way.
Again, this is the right way to do it. You have both the private and the free public healthcare. You have options. You can choose which one is best for you at that specific time and what level of healthcare you actually need. That is the beauty of having choice. And I think that we, especially in the States here, we need choice. We need a free public one and a paid private one.
So I'm a nurse living in Riyadh, Saudi Arabia, and this week I've been dealing with a pretty nasty eye infection. I've had to go to the doctor for it, so I'm going to share with you guys my experience with the healthcare system here in Saudi Arabia. This is what I looked like on my worst day. That was literally pus dripping down my chin. This is right when I woke up the next morning on my worst day, and sometimes you just have to laugh at yourself because why not? I checked myself into the ED because I called in sick to work, and in order to get my paid sick leave, I have to go to the ED to get checked out. I took a COVID test. Thankfully, it was negative. I also had a cough. I got my eyes checked out by 2 awesome female doctors, got my sick leave forms, and picked up my meds. I went home and started my antibiotics right away, and my eyes already feel better. This whole process was less than an hour, super easy, and it was completely free, including the medications. Healthcare here is honestly a vibe.
I want to give you guys a perspective when it comes to universal healthcare. A very close relative of mine had to have brain surgery in Spain. And throughout the whole process, I thought there was going to be a huge bill. So I was getting myself ready for that. My family members stayed about a week after their surgery in the hospital to make sure that everything was okay with them. Throughout that, they were fed 3 times a day, regular food, okay? No jelly and oatmeal like they give you here in the US. Once they were discharged from the hospital, I went in and asked if we can get the bill. I was so shocked that there was no bill, but there was a prescription for medicine. So they said, no, we were sending prescription for medicine. The medicine was about 30 euros or so. The thing about the US is that we think we have to have an amazing job just to get some form of healthcare. In the US, if you make, let's say, $100,000, you will have to pay out of your paycheck about $300 to $400 each month. And then your employer matches that as well, depending on the health insurance that they have and the one that you pick. And you would think that would cover the basics, like your doctor visits, your women's health, checkup every year. Surprise, surprise. Even when you pay your premium every month, you also have out-of-pocket expenses, meaning that you will have to pay within 1 year $6,000 or more for every time you go to the doctor. So every time you go to the doctor, you pay that full bill to the doctor. The other thing we found out was that certain doctors' practices have an agreement with the health insurance about how much you get charged. So one time we asked this doctor, we called and we said, we don't have health insurance. How much is it? And for a visit. And they said, about $150, right? And then we hung up and we called the doctor again and we said, we have this health insurance. How much is for the visit? And it was about $300. I don't understand that part. Why is it more expensive when you have the health insurance versus not having health insurance at all? But the other thing that I saw was that in Spain, even when you have what's considered a low-paying job, you will still have health insurance. You don't need to have the most amazing job at a corporation in order for your basics to be covered. So if you end up in the hospital, all of those things will be covered. And the medicine over there, for me, it was surprisingly cheap. It was about, $10, $15, depending on how many things you get. Americans have been brainwashed, literally, to think that this system cannot exist in this country. The other thing that I saw is that in Spain, I don't think people become millionaires based on this system. Nobody thinks I'm gonna go into health insurance in order to make a lot of money. You understand? So there's no such thing, right? I don't think even doctors don't become ultra rich because of health insurance. And we're not talking about, I'm just gonna get cosmetic surgery. There are people here in the US with things that they didn't choose, like cancer or diabetes, right? That you really need to go through treatment. And those people are being denied healthcare. It just doesn't make sense.
But Americans need to stop having perspective and think that this is not normal, that they have been lied to, used, exploited, and that it is possible to pay into a system that doesn't make certain people rich while poor people, or while you, even with, your $100,000 job, have to think about whether you want to get life-saving surgery or not, and whether you're going to go broke or your family go broke because of the expenses.
I appreciate you guys watching the video today. Please make sure to like, comment, and subscribe down below, and I'll see you guys in the next video.